I've had back problems for over 20 years, and it got to the place where it was getting harder and harder for me to do just my everyday chores. My back was really a problem. I couldn't take it anymore. I had had already a couple of surgeries, and these were only just minor fixes for me. My daughter passed away, and she had a 6-year-old and 13-year-old, and I took over raising them. So now I was not only a grandparent, but I was a mother too. I loved being with him in sports. I loved watching him play football. I always sat down lower, and I sat between the 40 and 50. That was my seat, because I could see both sides where he was running with the ball. I had anything you could get for back problems, but it wasn't helping me. I had a pump put in and had to have it filled every couple of months. I went in for my appointment, had the pump filled, and I was walking out so disgusted and upset. And as I walked out, I saw these pamphlets. I never ever bothered to pick them up before, but this time I picked it up. I got into my car, and I don't know why, but I opened the pamphlet, and there was Dr. Shepard. So when I got home, I called Methodist Hospital. I got Dr. Shepard's number, and I made an appointment.
When I met Sue, the first thing came to my mind that no one should live like this. She already had morphine pump to treat her pain and not her condition. She was bent over, bent to the side, could not stand straight. You should see the stress and the strain on her face.
Even though she participated and she still went to the school, I don't think that she was probably doing it the way that she wanted to. And she saw herself progressively becoming worse. She wanted to do something about it.
Dustin was playing football, and senior night was coming up, and I knew I had to walk with him down on senior night, and I was walking with the cane. I was bent over, and I walked out on the field with him. I just realized I wanted to have the surgery get done, so when basketball season came, I would be able to walk with him straight without a cane.
I spent 11 years in New York, and over half of them were dedicated to learning about spinal deformity, both on the academic research level and also the clinical level.
I was in a process of bringing Dr. Patel here, and since this is a complex and long surgery, I decided to wait for Dr. Patel and give her the benefit of our skill.
Dr. Shepard and I pride ourselves on being the only team in Northwest Indiana to take care of spinal deformity patients. It's so important for a patient that's going to undergo spinal deformity correction to have a goal in mind. She wanted to walk across the floor on senior night with her grandson, but she wanted to walk upright. Dr. Shepard and I discussed the case, and we thought we could make this happen.
I just had a lot of faith and trust in them. Dr. Shepard and Dr. Patel did the surgery for me, and I worked hard. And when it came down for basketball on February 23rd, when Dustin took my arm, I was standing straight and tall. I walked out there. They always clap for the seniors, but they were clapping really hard when they walked out with me. And Dustin says, you know, Grandma, part of that's for me, but it's really for you that they are proud of you.
When you look at a case like Sue, and you look at her face prior to the surgery, and then you look at her face after surgery, you could see the stress and the strain change to a smile and relaxation.
People that have these procedures, their lives are changed drastically.
I believe now, if I did not have that surgery, I would either be close to it or be in a wheelchair. And that's not the kind of life I wanted. I still have pain now and then, but I can stand up as good as you. I can walk. I can, if I had to, I'm sure I could run, and I think I could even dance. Dr. Shepard and Dr. Patel are my special people, because they are the ones that got me to where I am now. And even now when I see them, they are just, they're doctors, but they also make you feel like they're your friend too, you know. I think I felt proud, I felt good. I felt like I had accomplished something, I really did. I felt that here I am, a person that was bent over a few months before, now walking straight with my grandson and being proud of him and proud of myself for doing what I did.